If your body was sending you warning signals that something is going wrong, would you know how to spot the signs? What if something was seriously wrong? Would you know? Well, your body gives out lots of helpful clues when things are going wrong or things are out of sync. In this video, I'm going to go through what you need to know to spot the early signs that things are going wrong and the essentials about what you need to know. Ignoring these symptoms can sometimes be really easy to do, especially as we go about our daily routines. But it can be the difference between the early diagnosis and the late diagnosis. And with cancer, this can make a huge difference. In this video, we're going to break down the key signs that you need to look out for, both in the early stages and the late stages. What is cancer? Cancer is often a word that's bandied around, but how many people really know what it means? Cancer is not just one disease, but a collection of related diseases. These diseases involve abnormal cell growth. Cancer involves abnormal cells which are growing rapidly, and this means it can invade other areas or spread all over your body. Unlike normal cells, cancer cells grow, divide, die in an abnormal way, a process that can lead to masses of cells where they're not supposed to be, and we call these tumors. Early signs of cancer. The early signs of cancer can be easily confused for other conditions, so that's why it's key to be aware of your body and notice when it's going through changes. Often these symptoms are initially quite vague and it's quite hard to work out what's going on. That's why you need to pay close attention. Cancer can affect anyone at any age, but it's more common over the age of 50. The most common types of cancer usually is breast cancer, lung cancer, bowel cancer, and prostate cancer. But there are over 200 different types of cancers. Each of these types of cancers can have their own specific list of symptoms, but there's some general symptoms which go along, which I'll go through now. Number 1, night sweats and low-grade fever. Often people just dismiss this as poor sleep or a minor bug, but if they keep going on for a long period of time, it could be early signs of a cancer. Loss of appetite and unexplained weight loss. When you're losing weight but you're not trying to and you're eating a normal diet, this can be a sign of cancer. Remember, there's other conditions that can also be causing this, which are more common, like an overactive thyroid. Persistent fatigue and nausea. Beyond normal tiredness, if you're getting excessively tired, this could also be an early sign of cancer. If you're sleeping a lot, not going through any additional stresses, following a normal diet and exercise routine, but you're having persistent tiredness that's lasting a long time, this could be an early sign. Remember, there's other conditions that can cause this, like chronic fatigue, an autoimmune condition, or having a mood disturbance like depression. Number 4, anemia. This is a common effect of cancer, which means you have low levels of red blood cells. Having low levels of red blood cells can make you feel tired and weak. As you can imagine, these are all vague symptoms, so it's a little bit tricky to work out what exactly is going on. Often, if you go to see a doctor, we might do tests like blood tests as a starting point to see what's going on. We will usually check for things like anemia, your thyroid levels, your hormone levels, to see if there's any other more common reasons why you're experiencing these symptoms. Advanced cancer symptoms. As I've explained earlier in the video, as the cancer cells start to grow and rapidly multiply, you will often experience additional symptoms. Your symptoms then become more distinct and often more severe, so it can be easier to spot what's going on. Symptoms you might experience is persistent pain. Unlike temporary aches and pains, this is constant, ongoing, and it's not linked to exercise or your lifestyle. Noticeable lumps or changing skin. Visible growths might be noticeable on your breast, your testicles, as well as your lymph nodes. So you might notice a lump in your armpit or around your groin area. Changes in your digestion or your bowel habits. Ongoing digestive issues like stomach aches or diarrhea can also be signs things are going wrong, especially if this is ongoing, because if you have a tummy bug, we will expect it to resolve in a week. So if you're having weeks of symptoms, like 4 weeks or more, it's very important to see a doctor so we can work out what is going on. And in some cases, it could be due to a bowel infection. Extreme fatigue. If you go into more advanced signs of cancer, it can be hard to go about your daily routine. You might feel you're excessively tired, breathless, getting aches and pains. It will be hard for you to function in your normal lifestyle. Again, I would like to point out a lot of these symptoms are again overlapping with other conditions such as Lyme disease, bowel disorders like inflammatory bowel disease, as well as other types of infections. But the most important thing is to see a doctor early so we can discuss your symptoms with you. Overlapping symptoms. Cancer symptoms often resemble other serious health conditions. That's why usually you'll need medical tests to work out what's going on. My top tips for when you're speaking to a doctor and you're worried about things like cancer is to write down your symptoms, so when you go to the consultation, you remember to bring up all the things you're worried about. When you're speaking to a doctor and you're face to face, sometimes you can forget all the things you wanted to say. So a lot of my patients will just make notes on their phone and bring it to their appointment. Another top tip is to write a symptom diary. Write down the days or the times when you're noticing your symptoms so we can look for patterns. So for example, if it's after you eat certain foods or do certain activities, we can see possible links. Number 3, another top tip is I really like it when my patients just highlight to me what they're worried about. For example, they might say, a friend of mine was diagnosed with bowel cancer and they have similar symptoms to me, so I'm really worried about this. This will help us to have an informed discussion about what's going on. We can discuss through their symptoms or what additional signs they should be looking out for, or it's easier for me to work out what's in their mind so we can have a very clear discussion. I also found it additionally helpful as a doctor if the patient tells me what they expect. So if they say, I'm really worried about bowel cancer, and we go through their symptoms, if they can highlight to me what investigations they were hoping for or what they were hoping for, it can be really helpful to have a discussion about it. Or for example, they might say something like, I was hoping for an MRI. Then it's easy for me to have a discussion with them about MRIs and in which conditions it's useful. For some conditions, it might be more useful to go for an ultrasound or blood test initially. So that's why it helps me to know what's in a patient's mind when they come to the consultation. Another helpful tip is when patients write down their weight changes or things that they've noticed. For example, their clothes are hanging looser or they're unable to walk to work anymore. These can all be useful signs in working out what's going on. Remember that knowledge is power. You don't know what you don't know. That's why it's important to see a doctor early if you're not sure what's going on. In summary, with cancer, it's really important to detect it early. That's why it's important to see a doctor if you've got any of the symptoms in the video, or you're not sure what's going on, or your symptoms have been going on for a while and they're not getting better. Some common questions that my patients ask me are, is cancer genetic? Yes, some types of cancer can be genetic. Some cancers are when the gene changes or mutations are passed on from generation to generation. For example, with some types of breast cancer. This doesn't mean you're always going to get the cancer, but if you do have family histories of certain types of cancer, it's important to see a doctor so we can know what to look out for, and in some cases you might need genetic testing to see if you have the genes linked with that type of cancer. Can cancer be prevented? While not all types of cancer are preventable, you can significantly reduce the risk by having a healthy lifestyle, maintaining a healthy weight, avoiding tobacco, limiting alcohol, exercising regularly, making sure you take appropriate vaccinations like the HPV vaccine, and avoiding excess sun exposure are all useful tips in avoiding cancer. How is cancer diagnosed? Cancer can be diagnosed with a variety of tests. In some cases, we start off with investigations like blood tests, then we do scans, then we need to do more advanced types of scans like MRIs, and then in some cases we need to do advanced types of scans like biopsies, where we take small samples of the lump and look under a microscope and check for cancer cells. The type of test that's appropriate depends on the type of cancer we're looking for. But if you have vague symptoms, we might just start off with blood tests to see if we can notice any abnormalities. For example, signs of excess inflammation. What are stages of cancer? Cancer stages are usually from 1 to 4, and normally it signifies the severity or spread of disease. Stage 1 is normally localized, and stage 4 is when it's spread to other parts of your body. Thank you for watching today's video, and if I can ask for a favor, if you click the subscribe button, it really helps my channel to keep growing. And if you can write a comment below, I'll respond to you. Thank you for watching. Bye bye.